Hi, Dave with Align Therapy here. I wanted to talk about one of the most common exercises in Schroth training, the semi-hang. But first, let me just describe a little bit about scoliosis and why we do the semi-hang. So come over here. So if we have a scoliosis curve, that's someone's head. This is the back of them. So here's their hair. If we have a scoliosis curve, most curves look like this. They curve to the right in the thoracic and to the left in the lumbar, and then here's the pelvis. So the first thing that we want to do is actually elongate the spine and get more length out of the spine. So if I pull both directions on the spine, then the spine straightens out, so the S turns into a little bit straighter of an S, or more like an I. So normally gravity is pushing down and creating more compression at the spine. So we're just using gravity to do the opposite. We're allowing it to elongate the spine. This exercise makes sure that you don't have any shoulder issues. This isn't one that's way specific to curve pattern, so most people should be able to do this one. Just make sure you're doing it controlled, that there's no pain, and that it feels okay. Most of my patients actually really like this exercise. It feels good. So the way we do that, we use these stall bars, and you grab onto the bar at eye level, and then with your feet underneath the bottom bar. So this, for me, it would be this high. My feet are under the bottom bar. I bring my body down like this, and I just let my back stretch. So the biggest thing with this, a lot of people will go like this. So they're not pulling their pelvis under. They are pulling their pelvis under. They're not allowing full hang like this. So when you're in this position, you're supposed to breathe and expand your ribs. So breathing in and breathing out. And doing that nice and controlled, trying to feel for the expansion in the ribs. And my legs aren't holding me up. I'm letting gravity pull down and just letting the back stretch. So that's the main one that we do a semi-hang. We try and just let gravity elongate the spine. If you want a little more muscle activation, a little more muscle strengthening, keep your hands in the same place, come down into the semi-hang, and then pull up using just your shoulder blades, like that. So my back position hasn't changed, but my shoulder blade position has changed. So be careful not to arch the back more. We're just using those shoulder blades. And then still breathing, nice and controlled, and expanding. So one of the biggest things with Schroth training is we really want expansion at specific areas of the back. So you should be feeling the ribs expand all through the back. And if you're feeling that, perfect. Good breathing, good expansion, and we're getting good elongation. So that's a simple exercise that you can do at home for scoliosis that gets a lot of elongation. But remember, if there's pain or any problems with that, don't do it. And best option is to get evaluated by a Schroth therapist before you start these exercises so that you know that they're right for you. Thanks.